I have applied for a religious exemption from mask wearing to the Veterans Administration Hospital in Des Moines. Here's my application. So what is religious about a mask? My legal and theological explanation stretches across 32 pages. Now here's my 60-word summary. Standing for truth and exposing lies is a fundamental Christian duty, and when mandates are supported not by evidence or science, but by censorship and with moral outrage over non-compliance as indignant as ancient responses to blasphemy, we're dealing with a state-established religion. The Bible is pretty clear how readily we should bow down to a false god. My first contact with the hospital was October 29th on the hospital website. I asked these questions. Why are masks still required to enter your hospital for everyone all the time, this long after peer-reviewed studies find no statistically significant benefit from them? For example, the Netherlands study published last November, while other studies document physical harm they cause. Some harm for most people after long use, and significant harm for some people after even a little use. If your answer is that you know about studies in favor of obsessive masking that I've overlooked, can you refer them to me? Is there any place in your medical system where the evidence for and against mask and vaccine obsession is compared so that we may understand the basis of your policy? If not, can you refer me to any forum in the world where doctors on all sides of the controversy can interact without fear of censorship? If not, will you consider being the first to create such a resource which will restore the confidence that your policies are in the best interest of our health? For people like me who read so much evidence from censored world-class doctors that masks and vaccines are not beneficial. In the absence of any such resource anywhere, the policy of any hospital that is so far contrary to science, apparently to appease bureaucrats and politicians with zero medical credentials, raises questions. How many other medical decisions are made at your institution so contrary to the best interests of our health? I've posted just a few of the studies that concern me. SaveTheWorld.saltshaker.us. The title is Application for Secular/Religious Exemption from Mask/Vaccine Mandates. And part one is the argument, why this is religious. And anyone interested, I'll send you a printed copy. Contact me. And part two is the evidence, the summaries of the research. So then on November 9th, I met with the hospital's patient advocate, Lori Claire, or Lori Sinclair, I'm not sure which it is. She said she would read my 40-page application and pass it to others. Actually, the 40 pages is just the legal and biblical argument that the issue, 32 pages. It's just that the issue is religious because mask benefits are a lie. And the other one's probably another 40 pages, what I have online. The evidence, the summary of the research. Now, Lori said the VA doesn't do its own research on the issue. It trusts the CDC. On November 28th, 11 days later, she left a phone message for me denying my request. No reason was given. She did not say that anything I wrote was incorrect. So now, December 4th, 2 days after the birthday of my brother, who is a famous chiropractor publicly advocating vaccinations and masks, I am posting this video record of my follow-up letter to the VA hospital, urging their reconsideration and, in support of it, presenting new evidence. And here is my follow-up. Dear Lori Claire, thank you for processing the application I submitted November 9th for a religious exemption from mask wearing, following my October 29th entry on your website, for reading it and for sharing it with your ethics board chair, Suzanne Tabor, and your hospital administrator, Laura Williamson, which you did according to the phone message you left Friday, November 20th. I've delayed responding to you until I could process recent developments. Cato, on November 8th, the day before I met you, the Cato Institute published its own review of mask studies, finding that, quote, the available clinical evidence of face mask efficacy, effectiveness that is of low quality, and the best available clinical evidence has mostly failed to show efficacy. With 14 of 16 identified randomized controlled trials comparing face masks to no mask controls, failing to find statistically significant benefit in the intent to treat populations. Of 16 quantitative meta-analyses, 8 were equivocal or critical as to whether evidence supports a public recommendation of masks, and the remaining 8 supported a public mask intervention on limited evidence, primarily on the basis of the precautionary principle. In other words, let's err on the side of caution. In case masks turn out to work, let's go ahead and require everyone to wear them. My summary of that study is enclosed. Bangladesh. I had told you about the Denmark study last November, which finds no statistically significant COVID reduction from masks. The other well-done study was in Bangladesh, August 31st, 2021, which I had read about but hadn't read. I wanted to double-check news reports about it by reading it myself. The Cato report increased my curiosity about it. The authors of this Bangladesh study glow with praise for the COVID reduction achieved by masks in their research. They found a whopping 1% greater chance of infection without a mask. Now that's according to biased self-reporting of symptoms. The patients, it relies on the patients telling the doctors what they experienced instead of doctors confirming by their own diagnosis. When self-reporting was double-checked by testing blood samples, that whopping 1% benefit dropped to only 0.09% greater chance of infection without a mask. Less than 0.1% benefit. Now, does that degree of benefit justify in your mind mask mandates for all your patients? Or any mask mandate anywhere outside an operating room or a dusty work environment? My notes on the Bangladesh study are also enclosed. Germany. I also learned a week ago about a German study published April 20th, 2021 that reviewed 42 studies that documented specific medical harms from mask wearing, from mild to fatal, especially from long-term masking. Most of those serious consequences have been paid too little attention to put numbers on the likelihood of suffering them, but the buildup of carbon dioxide and lowering of oxygen saturation, which is universally accepted as contributing to them, is suffered by everybody. Everybody. You included. My notes on that report are also enclosed. Don't remain ignorant of that study if you care about your own health. The Bible is obsessed with truth. It is at war with superstition and its false gods. Blind faith in a ritual that does no more for you than bowing down to a carved tree, enforced by censorship of strong evidence and marginalization of those who follow it, and validated by a new morality that treats disagreement like blasphemy, meets every reasonable definition of a false god. It makes nations ignorant, Isaiah 30. It blinds science and medicine. It pauses the centuries of progress under our Christian ancestors. Empowered by today's tracking technology, this surrender of individual scrutiny to whatever some anointed expert dreams up is a vote for the greatest tyranny ever to exist on this planet, this footstool of God. Give your patients a reason to trust your medical judgment. Don't require or even accept blind faith in you. Inform your patients. Don't surrender your own policies to blind faith in a bureaucrat. Don't just tell me you follow the CDC and the Mayo Clinic without telling me where among their resources they seriously address these studies. If you look, you will find they do not, unless you can get a lot more out of their search engines than I could. Don't be irritated when your patients want to be well informed. Inform them. If you think you follow the research better than your patients, don't keep that knowledge to yourself. Direct us to your evidence that masks significantly help and do not significantly harm. And if you don't follow the research, trusting the CDC to do all your studying for you, stop. Change course. Medicine did not advance as it has by doctors ignoring research. You told me the VA hospital relies on the CDC for research and does no research of its own. That's what you told me November 9th, but on the phone message you left for me November 20th, you threw in the Mayo Clinic website. Did you think those two institutions address the best research? I can't imagine how anyone could feel their position well informed who does not address the Denmark, Bangladesh, and German studies. The ones that are called well done, the thorough ones, the RCTs. Yet my following attempts to find them addressed on either side come up dry. I searched at the Mayo, mayo.edu/research. So I looked up, I tried to see if they said anything about the German study. I searched April 20th, 2021. That's when it was published. No results. No results for, no relevant results for April 20th. No results at all for Germany, the word Germany and masks. A phrase from the title of the study, masks that covers the mouth and nose, gets a couple of results that warn faculty must wear approved masks properly, covering the mouth and nose. No returns to the German study about masking harm. The Denmark study. In return for the returns for Danish mask wearers, nothing relevant, Denmark, masks, nothing relevant. No returns. The Bangladesh study, no results for the 2021 Bangladesh, or impact of community masking, which is a phrase from the title of the study. Mask research gets an article, How Well Do Face Masks Protect Against Coronavirus? Which, and I read that, and it doesn't cite a single study. Its authority is the CDC. It's published August 24th, 2021. It's presented the way a parent presents duties to children, omitting evidence which experience confirms children either can't understand anyway or don't want to think so hard about it anyway. There was a link to, if you want to, more in-depth information. Okay, so that link led me to 25 references, not footnotes, they're called references, which include neither the German nor the Denmark study, nor was it updated to include the Bangladesh study, which was published 6 days later. 6 references were to CDC posts, 1 to the WHO, World Health Organization, 1 to the FDA, Federal Drug Administration. A large number of returns came up for mask research, but only the first one seems relevant to mask research. So I searched, did the same kind of search on the CDC website after coming up dry on the Mayo Clinic website. Mask research, when I searched for that, it came up with a lot of guidance of what to do, but I didn't spot anything that looked like it included any evidence that any of its guidance was good. The first return was, improve how your mask protects you. Didn't list any references or footnotes. Now, although I couldn't find the studies addressed at all by searching, there was another time when I happened upon a paragraph in a CDC post that dismissed the Denmark study as inconclusive, when its the Denmark study finding of no statistically significant benefit was definite. It was not inconclusive, and the CDC called the study small. Though the Denmark study followed nearly 6,000 participants for 2 months. I had hoped that with the rejection of my application, you would have given some rationale for your decision, like some evidence that masks accomplish anything to counter the highest quality studies, which so they don't. I had hoped that the reputation of your hospital would mean enough to you that you would defend it. So now I am making a motion to update my application with a recent review of all previous mask studies, which was unavailable when I met with you, published by the Cato Institute. The study was published the day before I talked to you, but I only learned of it later. In light of this new evidence, I submit this motion to reconsider. From the abstract, the Cato abstract states, evidence of face mask efficacy is based primarily on observational studies that are subject to confounding. That means to cause to become confused or perplexed, to fail to distinguish, to mix up. And on mechanistic studies, that is, mechanical measurements by various contraptions, that rely on surrogate endpoints, substitute things measured other than actual infection rates with or without masks, such as droplet dispersion as proxies, substitutes for disease transmission. The available clinical evidence of face mask efficacy is of low quality, and the best available clinical evidence has mostly failed to show efficacy. With 14 of 16 identified randomized control trials comparing face masks to no face mask controls, failing to find statistically significant benefit in the intent to treat population. Of 16 quantitative meta-analyses, I read this before, didn't I? 8 were equivocal or critical as to whether evidence supports a public recommendation of masks, and the remaining 8 supported a public mask intervention on limited evidence, primarily on the basis of the precautionary principle. Dr. Martin Kulldorff, Senior Scientific Director of the Brownstone Institute, summarized the Cato study in Epoch Times. He said, "The truth is that there have been only 2 randomized trials of masks for COVID. One was in Denmark, which showed that they might be slightly beneficial. They might be slightly harmful. We don't know. The confidence interval kind of crossed 0. And then there was another study from Bangladesh where they randomized villages to masks or no masks, and the efficacy of the masks was, for reduction of COVID, was something between 0 and 18%. So either no effect or very minuscule effect." You told me the VA hospital doesn't do its own research in support of policies like mask wearing. Don't most of your doctors follow a lot of research? Isn't research what doctors rely on to advise patients about the risks they face with all manner of treatments and operations? Aren't your doctors a huge pool of knowledge about every kind of research on a matter affecting all your patients, like masks? Wouldn't it be an easy thing for you to ask your doctors for volunteers to assemble some responses to studies like those I cite, to make it available to any patient who asks about the evidence for your policy? And not just for the benefit of patients inquiring about your mandate for masks, but for your doctors and nurses when your mandate stretches to the deadly COVID vaccines. When that seemingly inevitable day arrives, will you doggedly fire them for resisting, yet still without addressing the research that alarms them? I'm curious. Are VA hospitals legally bound to CDC guidelines? If so, I want to learn what laws govern. This would be a more serious problem than I thought, because if medical errors by a government bureaucracy can only be corrected by an act of Congress or a constitutional amendment before doctors are allowed to exercise their best judgment for their patients, the healing of modern medicine will take far more work than I was hoping. Are you not legally allowed to do your own research or to publicly interact with the CDC in reviewing evidence? If not, if CDC statements are non-binding guidelines, then you have important reasons to do your own research, address alternative views, and publish it in a language accessible to lawmakers and voters, not only to assure patients that your policies are in our best interest, and to build public confidence that your grasp of medical facts, but to keep your doctors and nurses from quitting when your mandate stretches to COVID vaccines, as is already happening, which assures me that it is not just my medical ignorance that supports my concern, nor can the resistance of doctors be accounted for by profits from serving the ignorance industry, since way too many medical professionals are forsaking everything and gaining nothing. The CDC has obviously not earned their respect. And why should it? Was I wrong when I told you the CDC doesn't seriously address evidence that doesn't support its guidelines? Is it not true that vaccine manufacturers contribute significantly to the CDC Foundation? Could this help explain why a significant number of doctors and nurses are leaving medicine rather than take the jab? I don't know what the rate is. Even a 1% quit rate is overwhelming when that many are ready to take such a costly step. As my application makes clear, standing for truth and exposing lies is a fundamental Christian duty. And when mandates are supported not by evidence or science, but by censorship, and with moral outrage over noncompliance as indignant as ancient responses to blasphemy, we're dealing with a state-established religion. The Bible is pretty clear how readily Christians should bow down to a false god. Bangladesh masks, or for August 30th,